Good morning, everyone, and welcome to the third webinar of our webinar series on future-proofing child and adolescent health in Europe and Central Asia. So this is the third and last webinar of this series, and we'll be talking about the implementation of the draft WHO and UNICEF upcoming strategy on child and adolescent health and well-being strategy, with inspiring example of youth participation. Next slide, please. So a few practical points before we give the floor to Dr. João Breda for the opening remarks. So on the icon with the global word, you can select the language of your preference between English and Russian. So we'll have Russian and English interpretation throughout. And please don't hesitate to post your questions and comments using the two icons that you have on the bottom left. With the Q&A and the chat, we'll be screening that and replying to your questions. Dr. João Breda is the head of the WHO Athens Quality of Care and Patient Safety Office and a special advisor to the regional director, and we are very pleased to have him here to open for a few opening remarks. Dr. João Breda, over to you.
Thank you very much. Good morning or good afternoon, good evening to everyone. Thank you very much for the invitation, dear Sophie and team, and congratulations to getting to this point. I would like to welcome everyone on behalf of WHO Regional Office for Europe, but also on behalf of our Office on Quality of Care and Patient Safety based in Athens, working for the entire WHO European region. And really welcome to this webinar series on future-proofing child and adolescent health in Europe and Central Asia, and really on the topic of today, which is really very, very important. For us, this is really a critical moment for action. We all know that children and adolescents in Europe and Central Asia, they are really facing worsening health outcomes, from rising obesity and mental health issues to the decline on immunization rates. All of this is very worrisome. We have explored this in the first webinar of the series, if you were with us, as you know, and it's really why we need to take action. But at the same time, we believe there's a shared moment, a great opportunity and commitment for transformation. Working together, WHO and UNICEF, also in collaboration with other partners, and of course, under the guidance and leadership of our member states, we are really developing a new regional strategy to address the above-mentioned the challenges that I just referred to. This strategy, as you may, and I'm sure you already know, is grounded in 5 main principles, from investing early to ensuring high quality of care throughout. It really aims to transform how we support child and adolescent health and well-being. As a strategy is a powerful tool, but only if we implement. So the strategy, as sometimes might be seen as an end in itself, it's just the beginning of a process which we hope will turn into very, let's say, thorough implementation. Today we shift from vision to action. We are going to explore how the strategy can be effectively translated into real-world impact in countries, but also in communities, and particularly at the local level. So today is really about going from vision to action. Youth are not just beneficiaries, they're also, and they should be the drivers of change. Meaningful engagement of young people is paramount. It's essential to ensure the strategy really resonates, is meaningful for them, that is relevant, and really is conducive to sustainable improvement in health and well-being of young people. Implementation is really a responsibility of everyone, from policymakers to practitioners, educators, families, youth advocates. Everyone has a very important role to play in ensuring the strategy is not just adopted, hopefully in October, but really embraced and adopted by everyone at all levels, and really is, let's say, incorporated into the health systems of the future and services. So I really am very excited about this new event in this series, and really look forward for the discussions. Thank you very much, and I wish you a great day, a great morning of work, and I hand over back to Sophie Julian. Sophie, thank you very much. Over to you.
Thank you very much, dear João, for these opening remarks. I realize I haven't presented myself. So I'm Dr. Sophie Julien. I'm the Technical Officer for Children and Adolescent Health working in the WHO region for Europe. And so if you were not with us for the previous webinars, I just wanted to set up the scene very, very briefly. So this is, as I mentioned, the third webinar. So in the first one, we will be exploring a series of fact sheets, and I will put the link in the chat in a moment, which are the evidence base or part of the evidence base for the upcoming strategy, as it was also mentioned by Dr. Breda in his opening remarks. In the second webinar, we've been exploring the key pillars, the priority areas for action outlined in this WHO and UNICEF strategy for children and adolescent health and well-being, and we've been presenting inspiring country examples. And today, what are we going today? This is the agenda for today. We'll be presenting two main parts. The first one will focus on the quality of primary healthcare for children and adolescents across the region. We have three speakers with us. The first one will focus on the quality of primary healthcare across the region with the core priority of the forthcoming strategy. The second speaker will focus on the experience in adapting one tool, the WHO Pocketbook of Primary Healthcare for Children and Adolescents. And the third speaker will speak about the acceptability and uptake of this WHO Pocketbook across the region and about its sustainability. We will then move after a Q&A short session to the second part on inspiring example of youth participation. And we'll have also several speakers who will speak about the adolescent and youth participation in policy implementation, the youth engagement in the mental health stigma initiative with the country example in Kazakhstan. And then we'll have another country example in Cyprus about supporting mental health resilience among youth, following by another short Q&A session before the closing. So with that, I will stop sharing my screen and I would like to hand over the floor to Suzanne Caray, who is working with us as a consultant for children and adolescent health and quality of care here in the WHO Athens office. Dear Suzanne, over to you.
Thank you so much, Sophie. Good morning, good afternoon from my side as well. I have the pleasure to leading you through the work that the WHO and UNICEF are doing on primary healthcare for children and adolescents, which is the core priority of the forthcoming strategy for child and adolescent health and well-being. Next slide, please. Just as a quick reminder, these are the 5 priority areas of action of the forthcoming strategy. I will not go in depth into that, just to say that the area 2, high quality of care, delivering comprehensive and equitably high quality of healthcare, is the priority area of action that I'm going to focus on, and primary healthcare is a big part of that. Next slide, please. There is, I think, a policy agreement. It's safe to say that primary healthcare is the most inclusive, effective, and efficient approach to promoting health for all. This is not to say that we also need specialist and secondary and tertiary healthcare, but primary healthcare has to be core to any well-functioning health system. However, in the WHO European region and across the world, the reality is that children and adolescents do not always receive the care they need at the primary healthcare level. We have a lot of misdiagnosis, we have over-hospitalization, misuse of antibiotics, over-medicalization. At the same time, we see a lack of health promotion, including breastfeeding support. That leads to a lot of preventable mortality and morbidity and disabilities. And one reason for that is that primary healthcare providers sometimes lack the knowledge and resources they need to provide care that is evidence-based and in the best interest of the child and adolescent. Next slide, please. And for that, we developed a resource the pocketbook of primary healthcare for children and adolescents, and a corresponding app that you can see here on the side. Next slide, please. So the pocketbook aims to put at the fingertips of the primary healthcare providers the knowledge they need for the treatment, for the diagnosis, treatment, and management of common conditions, but also of less common conditions. The information to take up their role of coordination with specialists, with other levels of care, with other team members, and then also to provide health promotion and disease prevention. Next slide, please. Here you see a quick overview of the table of content. So I won't dive deeper into that, but next slide, please. I would invite you to download the app. All the information that is in the book can also be found in the corresponding app. And then you can see all the information that is included in these tools. One aim is to set standards that are applicable across the whole region for all countries. Next slide. But standards and knowledge is not enough. We also need, in order to be able to implement those guidelines, we also need a supporting health system. So what do we mean when we say supporting health system? Next slide, please. This is the health system performance framework published by WHO and the Observatory. And I would like to focus your attention on the left-hand side, which are the core function of any health system to ensure that service delivery, or for our case at the moment, the implementation of the pocketbook and the corresponding app can actually take place. And these are three: resource generation, governance, and financing. Next slide, please. So what do we mean by resource generation? So to implement the pocketbook, we will need a well-trained and motivated health workforce, and they need to be sufficient in numbers. And second, we need access to the needed equipment, supplies, and infrastructure. Next slide. This is a survey that the Athens office has run with the WHO member states to ask about training. So in order to be able to implement the pocketbook, we need health workers that are trained well. So if we look at the undergraduate training to become a medical doctor, that it ranges between 4 years and 6 years in the countries in the region. In most of them, it's 6 years. However, when you look at the years of postgraduate training to become a family doctor, there's a rather large range between 1 year and 5 years. So this is obviously only a proxy, not the time is not the only factor, but obviously you have more time to learn if the training is longer. Next slide, please. Here you see the variation in remuneration of payment that healthcare workers at the primary healthcare level caring for children and adolescents receive across the region. And there is quite a big difference, even if we adjust for purchasing power. So it will be ludicrous to think that we will have healthcare workers that can act based on evidence and in the best interest of the child if we don't value their work enough to pay them proper salaries. Next slide, please. If we come to the next point, the access to the needed equipment, supplies, and infrastructure. Next point. Next slide, sorry. We know from many countries that primary healthcare is actually in many settings a desk, a stethoscope, and a prescription pad. So there's only a limited amount of things that we can do with these tools. And that's the reason why, next slide. The pocketbook includes a list of essential equipment, supplies, and infrastructure demands that every country should be able to implement. Now, that for some countries in the region may mean that at the moment that's not yet possible, but these are the things that we need to make good on the primary healthcare promise and really deliver the care that is possible to deliver in a safe manner to all children and adolescents. Next slide, please. Here, this list continues, and it also includes certain point of care or rapid diagnostic tests and the possibility to draw blood and to aim for a one-stop shop approach to avoid unnecessary referral and hospitalization. Next slide, please. That was a quick dive into what it means to implement the pocketbook beyond just adapting, translating and adapting it for resource generation. Now coming to governance, there are several points in the book that the healthcare provider will not be able to implement unless there's a supporting governments and legislative framework in the country. For example, the standards say that each adolescent, each child should be able to receive care based on their evolving capacities, and they should be able to take decisions based on maturity. So, but if in your country the legislation says differently, you will not be able to implement that. Next slide, please. And we know from another review that here you see in green are the countries where adolescents are allowed to access health service based on maturity without parental consent, and the ones where you have to reach a certain age, either 14 or 15 or 18, 16, 17, or in quite a number of countries, you need to be of age in order to be able to make decisions concerning your health. And that is particularly important for sexual and reproductive health, but it's also relevant for the decision if I want to be vaccinated, if my parents don't want that, or for the access to mental health care services. Next slide, please. So these are the things that when adopting and implementing the pocketbook, each country will have to address to ensure that the health system is actually supportive of the implementation of the primary health care book. On the other end, we also need community support and appropriate behaviors from the demand side. Next slide, please. We know from a number of reviews and studies that there can be quite the pressure from parents that they would like a rapid recovery of their child, they want quick treatment solutions, they want antibiotics or specialist care and, you know, IV treatment. So we will have to work with parents and caregivers to understand the negative, the adverse effects, and the lack of evidence for some of these treatments for some conditions, not for all, but it will mean that we also need to engage with parents and caregivers as full partners. Next slide, please. So as said, working with community stakeholder involvement, gain behavioral insight to understand better, and create awareness and strengthen capabilities to be full partners. Next slide. And last slide. We are very happy to report that we also have translations to Ukrainian, Russian, and Spanish of the pocketbook already available. The French translation is underway. The world is looking to Europe. Other regions like the Pan American region and the Vista Pacific regions are taking over the pocketbook and adapt it to their country context. And we have already 15 countries that are in different stages to implementing the adapting and implementing the pocketbook in the region. And we hope very well that these other factors can be taken into account to make sure that primary health care is what it really can be for each child and adolescent in the region. Thank you very much. I will stop here.
Thank you very much for this wonderful presentation, dear Susan. I would suggest we take the questions at the end of the 3 speakers of the first part. So, and please don't hesitate to put your comments and other questions in the chat. I would like now to hand over to Dr. Yildiz Artikbayeva, who is from the Ministry of Health of the Kyrgyz Republic, and she will be sharing with us the experience in adapting the pocketbook on primary healthcare for children and adolescents that Susan just introduced, in the Kyrgyz Republic. Dr. Artikbayeva, over to you.
Добрый день, уважаемые участники вебинара. От Министерства здравоохранения Кыргызстана я приветствую всех участников и хочу поблагодарить организаторов данного вебинара за приглашение для участия на этом совещании. Можно следующий слайд тогда? На сегодня у нас в Кыргызстане проживает 7 миллионов населения. Из них женщины фертильного возраста составляет 51%, дети от 0 до 15 лет 32%. Как вы видите на этом слайде. Я хочу сейчас остановиться на текущей ситуации по оказанию первичной медико-санитарной помощи детям у нас в стране. Первичную медико-санитарную помощь у нас в республике оказывают центры семейной медицины, центры общей врачебной практики, группа семейных врачей и фельдшерские, акушерские на уровне ФАПов. В районе обслуживания фельдшерско-акушерских пунктов проживает у нас 26% населения республики. И ежегодно к врачам организации здравоохранения, оказывающие первичную медико-санитарную помощь, осуществляется более 11 миллионов визитов, как вы видите на этой таблице. Численность врачей и специалистов со средним медицинским образованием в организациях здравоохранения на 10 тысяч населения у нас составляет 18,3 и 45,8 соответственно. Укомплектованность врачебными кадрами на уровне первички, как видно на таблице, находится ниже 80%, а средним медицинским персоналом около 90%. Кроме этого, на уровне первичной медико-санитарной помощи у нас оказывается экстренная неотложная медицинская помощь. Есть специальные большие 2 центра в городах и бригады, входящие в структуру центров и организации здравоохранения, которые оказывают первичную помощь. Население республики на сегодня обслуживает 102 врачебных общепрофильных бригад и 80 специализированных бригад. Выделены специальные врачебные штаты, на которых работает 213 врачей на сегодня. И выделяются специалисты, 1300 специалистов со средним медицинским образованием. Следующий слайд можно? Следующий слайд можно? Что-то я не слышу. Важной характеристикой здоровья населения мы знаем, что является показатель детской и младенческой смертности. У нас в стране последние 10-15 лет по-прежнему наблюдается устойчивое снижение показателя, но остается в высоком уровне. Как вы видите, в этом графике в 2024 году было показатель 13,9, почти 14 на 1000 живых, родившихся живыми. Напротив, когда в 2022 году было 14,3, то есть имеет тенденцию снижения, но оно считается высоким. Если посмотреть структуру причин младенческой смертности, на первом месте у нас заболевания или отдельные состояния, возникающие в перинатальном периоде, составляя 57,6%. И на втором месте у нас идут урожденные аномалии 16%, на третьем месте у нас идут болезни органов дыхания. И из числа умерших первый месяц после рождения около 70% составляют недоношенные новорожденные. Смертность новорожденных почти в среднем в 2 раза выше по сравнению с остальными странами СНГ. Коэффициент смертности детей до 5 лет у нас выше в сельской местности и в домохозяйствах именно сельской местности. Можно следующий слайд? У нас в стране каждым годом больше рождается детей с врожденными пороками развития. Как вы видите на этом графике, мы в том числе с хромосомными аномалиями ежегодно рождается до 2000 детей с врожденными аномалиями. У нас с 2022 года начата процесс внедрения или адаптации карманного справочника у нас в стране. Впервые в 2022 году была проведена ориентационная встреча по ознакомлению с новым карманным справочником Всемирной организации здравоохранения по оказанию первичной медико-санитарной помощи детям и подросткам. Под руководством Министерства здравоохранения есть приказ о создании и при поддержке странового офиса ВОЗ и ЮНИСЕФ была сформирована мультидисциплинарная рабочая группа, состоящая из 33 специалистов, включая национальных и региональных координаторов, профильных национальных центров, кафедры детских болезней и неонатологии, и национальных медицинских институтов и узких специалистов, то есть психиатры, детские акушер-гинекологи, травматологи, лор-специалисты. Следующий слайд можно? Следующий слайд можно? Каждая предлагаемая, я хочу здесь показать, вот здесь я уже сказала, вот такой приказ, и у нас работала вот большая рабочая группа, мультидисциплинарная группа. Следующий слайд можно? У нас каждая, согласно приказу, это рабочая группа работали, адаптировали все главы, были проведены более 4 онлайн-сессий совместно с экспертами Всемирной организации, где обсуждались каждая глава, включая приложения, схемы, таблицы. Процесс адаптации включал в себе изучение каждой главы соответствующими специалистами и сопоставление данных руководства с нашими нормативно-правовыми актами, это клиническими руководствами, протоколами, положениями, с указанием на доказательные источники и ссылки. Каждое предлагаемое изменение или вопросы отправлялись для изучения экспертом ВОЗ с указанием на доказательные источники. И в ходе вот этих 4 онлайн-сессий мы эти вопросы обсуждали и конструктивно, и решения принимались с обоюдного согласия. Комментарии и предложения были обсуждены в рамках рабочих совещаний с офисом ВОЗ. И в результате у нас была разработана кыргызстанская версия карманного справочника по оказанию первичной медико-санитарной помощи детям и подросткам. Следующий слайд можно? И в данном слайде вы видите пример рабочего документа. Принятые изменения в основном в этом карманном справочнике касались у нас 3 главы, где были изменены количество визитов на дому и приемы здоровых детей в поликлинике согласно имеющимся нашим нормативным документам. Они изменены согласно с национальным календарем прививок. Были также адаптированы рекомендации в разделе «Питание». И в 9 разделе, по-моему, экстренные ситуации, где травмы, были внесены коррекции по частоте вентиляции легких и уровню гипогликемии при неотложных состояниях. Следующий слайд можно? Сейчас у нас в настоящее время выпущен первый новый карманный справочник ВОЗ по оказанию первичной медико-санитарной помощи детям в объеме более 1000 страниц. В настоящее время идет редакция книги, планируется оцифровка справочника и перевод на кыргызский язык. Одновременно у нас большой рабочей группой для внедрения карманного справочника до дипломного образования идет разработка учебных модулей с обновлением учебных программ до дипломного уровня и для повышения квалификации медицинских работников первичной службы. После дипломного образования тоже идет большая работа по разработке учебных модулей, обновлению учебных программ и готовимся к проведению тренинга для тренеров, для преподавателей медицинских вузов и СУЗов. Разработанные мероприятия для успешного внедрения должны включать, мы думаем, наличие ресурсов, материалы, инструменты, обучение медработников и разработка индикаторов. Следующий слайд можно? Справочник, вы знаете, приведена информация для специалистов первички, для координации помощи детям и подросткам с долгосрочными нарушениями и заболеваниями тоже есть. И там есть скрининговые тоже тесты. У нас в стране сейчас проводятся, согласно приказа, 3 заболевания. Это врожденная гипотрофия, фенилкетонурия и адреногенитальный синдром. Уже закуплены реагенты на сумму 37 миллионов. Проводятся с 2017 года слуховые аудиологические скрининги и ретинопатия недоношенных. С 2019 года внедряется, у нас это начато дальше усовершенствуется. Я уверена, что карманный справочник будет являться актуальным инструментом для наших медработников первичного звена, и потому что он содержит очень хорошие рекомендации на базе доказательной медицины, и мы успешно внедрим, и карманный это поможет как бы обеспечить доступность медицинской помощи всем детям и подросткам нашей страны. Спасибо за внимание.
Thank you so much, Dr. Artikbayeva, to share your experience in the country. It's been a pleasure to be working in this journey, and a big thank you as well for the WHO country office to support the work. So this is an example of how we work, and we can work with the countries in the region. We will reply on one question on this aspect after the next speaker. Thank you once again. And now we'll move to an area that Dr. Artikbayeva has briefly mentioned. Acceptability, uptake of the pocketbook across the region, sustainability for long-term implementations. So with that, I would like to give the floor to our next speaker, Dr. Laura Reali, who is the president of the ECPCP. This is the European Confederation of Primary Care Pediatricians. Dear Laura, over to you.
Good morning, everyone. Here are my slides. Thank you. Well, thanks to the organizers for the opportunity to speak today of an issue of such critical importance as the acceptability and uptake of the pocketbook across the region and sustainability for long-term implementation. As president of the European Confederation of Primary Care Pediatricians, representing 23 European countries and more than 20,000 European primary care pediatricians, I'm proud to recall our collaboration from the beginning in creating the WHO's Book of Primary Health Care for Children and Adolescents with the WHO Region Europe office. This is a resource that has significant potential as a foundational tool for evidence-based, high-quality, and equitable primary care. Well, the pocketbook aims to provide not only a guideline, but also a unified framework and common language for health professionals across countries and disciplines. Had Kyrgyz Republic speech has already shown, bridging the gap between policy and practice, particularly, but not only, in resource-constrained environment. This means that it is very useful for every country, including my country, for example, Italy. In fact, it's a setting standard for rich and poor countries and setting alike. Evidently, for some countries, that may mean that they have up to upgrade their settings. However, its widespread adoption and integration in many European countries can be hindered by different factors, as Susan Karai already showed, such as language barriers and variation in healthcare system structures, for example. So, to realize its full potential, the pocketbook requires endorsement by primary care pediatricians, physicians, nurses, and midwives, broad adoption by countries, and sustained implementation, ideally supported by a robust training infrastructure like an e-learning platform. Well, going in depth to the issue of my presentation, please, next slide. Acceptability is the first point, and the acceptability of the pocketbook is determined by its perceived relevance, format, language, cultural adaptation, and compatibility with the daily practices of child and adolescent primary care professionals. Despite being developed with attention to evidence and equity, the pocketbook may be perceived as distant from the practical realities due to the variation in European primary care systems. I have had these reports from some countries of my association. Enhancing acceptability requires content that is practical, case-based, locally adaptable, alongside the essential involvement of local users in testing and adapting materials. It's evident that professionals are more inclined to utilize, recommend, and integrate the pocketbook into their practice when they find it applicable, manageable, and respectful of their existing constraints. And then, what about the uptake across region for the pocketbook? Uptake means adoption of the pocketbook, and it refers to its desirable and increasingly widespread use by healthcare professionals in different countries through reference and integration into curricula or standards. That's important. For example, the pocketbook published in 2022 has an adoption still limited, as we have heard, by the lack of accessible translations in many European countries, for example. A 2024 study on WHO standards for pediatric and adolescents primary care healthcare in Europe and globally indicated a gap between the availability of pocketbook and its routine use in numerous nations. On the other hand, periodic surveys by the WHO European region reveal a persistent disparity in access to quality primary care for children, with many countries reporting suboptimal pediatric primary care compared to benchmarks, suggesting that the adoption of the pocketbook must be implemented to drive widespread change in practice. And so, what about the sustainability for long-term implementation? I think that for pocketbook to have a lasting impact, its adoption must be sustainable, a condition that depends on infrastructure, ongoing support, institutional commitment, and mechanism to maintain relevance over time. It's not a matter of funding. A dedicated e-learning platform at this point is crucial for this sustainability, and it can support continuous training, updates, feedback loops, monitoring, and adaptation. Next slide, please. There are evidently key components, that contribute to sustainability, and they include integration into existing education systems, continuous professional development, institutional and political support, monitoring and evaluation systems. Integration is a crucial point. Incorporating pocketbook into the curricula of pediatrics, family medicine, nursing, and public health ensures early and repeated exposure, making pocketbook standards part of professional identity, as Kyrgyz Republic has already shown. Continuous professional development, offering accessible formats such as workshop, blended learning, tutoring, and so on, can overcome the geographical, temporal, and financial barriers. Institutional and political support, it is not only approval from health ministries, but professional societies and academic institutions, along with regulation or guideline referencing of pocketbook, solidifies the pocketbook position. Of course, adequate funding for the platform's translation, updates, and maintenance is also essential. And monitoring and evaluating is already it's also important, because we can't have the consistency of what we are doing if we can't evaluate it. So, next slide, please. In a so complex process of spreading and implementation, we should propose some priorities for pocketbook implementation, like raise awareness and promote acceptability, and following are the actions that should be done, and develop a robust and e-learning platform, as I've said, and with multilingual, modular, interactive, and to track the progresses. And then ensure policies and institutional support, as I said, implement pilots and scale up uptake, integrate pocketbook in the curricula and continuous professional development programs, and monitor and evaluate. It's the last but not the least in our sequence. Next slide, please. We can't forget that the role of the stakeholders is crucial, because if the stakeholders are not involved, the process can go on. Advocacy is one of the most important points, because support pocketbook in our countries, push for translation, push for institutional adoption is crucial. And this is a request to all our stakeholders of this process. And training multipliers is another task that we have to realize and to be involved, because it's important to spread the pocketbook use. User feedback and cultural adaptation. This is a very important point for gather feedback from professionals in rural or urban context. And then we can know what works, what doesn't, and transmit it to WHO or pocketbook developers. Training multipliers is our tool to obtain a better improvement of the results. And as you can imagine, my major point of interest is evaluation of the outcome. So next slide, please. I want to underline the key messages of this short speech. We have 3 pillars under the pocketbook: acceptability, uptake, sustainability. One cannot exist without the other, of course, and we have to improve them. E-learning platform is essential, and not only for the long-term implementation, but also for continuous update. Therefore, we must act on all fronts: awareness, translation, integration in curricula, policy support, monitoring, and feedback, because we are the stakeholders. We have to push this process. We mean pediatricians, nurses, midwives, all the health professionals involved in primary care. And if we succeed in aligning these 3 pillars, the pocketbook can become more than a guideline. It can become a really living tool, shaping everyday practice, improving the quality of primary healthcare for children and adolescents across Europe, Central Asia, and beyond. Why not? Thank you for your attention.
Thank you very much, Dr. Reali, for your presentation. So finishing this first part, and with the 3 speakers, we wanted to provide you a comprehensive explanation of the different items that are needed for a successful implementation of the pocketbook, and how these highly contribute to the implementation of the UNICEF and WHO Strategy for Children and Health in the region. We have 4 or 5 minutes for a few questions, so please write your questions in the chat. We can start with a question from Croatia, who is asking what is the procedure in translating and adapting the app on Croatian language. Maybe I can hand over to you, Suzanne, to give a reply to Sanya.
Thank you, Sanya. So, and thank you, Sophie. So the biggest work is actually the translation and securing the funds to do it. There are some countries where doctors have actually formed a small working group and have done the translation themselves. Others where professional translators have been hired. Ideally, there is a small working group, like 12 to 15 people, who then take the translation and make needed adaptations. I think Laura alluded to the need of that very nicely. However, we also learned that actually the amount of adaptation needed is not so big. Mainly this is like the immunization schedule, the legislative framework, and the child visits that differ, as well as the referral pathways. So because the regional pocketbook stays a little generic and says, refer here and there, while you may in a given country be able to be more precise and specific. Having said that, if you want to do it in collaboration with WHO, and you would like a WHO logo on that, then we would have to work together. You can reach out. There are then some requirements that the changes need to be made specific at the end of the book or in the app. However, it is published under an open license agreement. So if you follow the rules of that, you also can just go ahead and make all the changes you needed, but then it needs to not carry the WHO logo and make very clear that WHO does not endorse at all anything that was changed. I hope that answers the questions from the start. I hope we will have many more languages. It's a big work, but it's lovely to see how the countries are moving ahead. Thank you.
Thank you very much, Suzanne. And yes, please do not hesitate to contact us. I don't see any other questions in the chat. I see some comments from Metanet. Thank you very much for the comments. So if there are no questions, let me thank again, a big thanks to our 3 speakers for this first part. And I will hand over to my dear colleague Gabriele Fontana, who is a regional health advisor at UNICEF, to kick off this second part of the webinar with inspiring example of youth participation linked to the implementation of the strategy.
Thank you so much, Sophie. I hope you can hear me and nod would help. Perfect. Colleagues, it's a pleasure to be here. And indeed, before we start the second part of this webinar, I also want from UNICEF side to reiterate the importance of the primary health care pocketbook and its adaptation in countries is really a very impressive tool that helps to standardize quality and services for children. And together with WHO, we are supporting its adoption in all countries, and we really stand behind it. Now, youth active participation. Why are we having this topic in today's seminar? As we were developing together with WHO and representatives from member states, the regional strategy for child and adolescent health, we did involve youth and young people from all over the region to provide their views, their inputs in the strategy itself. And the strategy will be endorsed by member states at the end of next month in Copenhagen. Seeing this, and during the development of the strategy, several member states asked us to support them in identifying ways to involve young people also at national level, not only in the development of the strategy and then in its adaptation at country level, but also in its implementation. And that's why today we want to provide a couple of examples of how this has already happened in 2 countries. Cristina Baccalazzo is our adolescent development and participation advisor and expert in our regional office. She will walk us through these two examples. One is from Kazakhstan, another one is from Cyprus. And she also will facilitate the question and answers after the two presentations. To take stock of, there are many. These are two examples that we decided to present today, where the Ministry of Health and youth advisory boards or youth groups have come together and have managed to work jointly to achieve common goals. And I will not go into the details. Christina and the colleagues, both from the Ministry of Health and youth representatives from these two countries, will illustrate what they have done, what they have achieved so far, what have been the challenges and the lessons learned. And we want this to be a bit of an appetizer and a teaser to show what is possible, and to then explore with each one of the countries that will be interested how we can set up similar mechanisms or leverage existing mechanisms in countries where we have already youth advisory boards or youth groups that can be engaged in a systematic way, in an active way, to support child and adolescent health. And with that, over to Cristina. Thank you.
Great, thank you, Gabriella. Good morning, colleagues. Good morning, everybody. I'll share my screen. One moment. There we go. Super. And does that show for everybody? I'm assuming so. Yes, good morning. So my name is Cristina Baccalazzo. I am the adolescent and youth participation and development expert, as Gabrielle said, at the UNICEF regional office. And today, before we get into the participation examples from our two case study countries, I wanted to bring us back to some of the basics of what we are talking about when we talk about adolescent or youth participation. And I think it's important for us to recall that we use this term participation in a very common sense sort of way in our everyday language. And we often think of participation to mean simply to take part in something. You know, a young person takes part in school. I took part in a football match, these types of examples. But when we are talking about child and youth participation in policymaking, in a rights-based framework, we are really actually talking about the ability of adolescents and young people to have a say or shape decisions that have an impact on their lives. And really the two components that we need to think about when we think about participation is both A, having a decision point, and B, the ability for a young person to shape that decision. And of course, for all of us working in public health, in policymaking, in developing programs, we can think of several decision points in which it may be valuable to have the views and the inputs of young people. And young people in these ways can be consulted, they can give inputs and give advice. They can, in some instances, even co-design a particular intervention or a policy or a decision, or co-create that. And even in some cases, potentially even lead processes or make decisions. And all of these are valid ways to engage young people. And we'll go through the different examples a little bit in the rest of our session today. So I think that for the part of practitioners, of policymakers, it's often important to reflect, why do we need adolescent or youth participation at all? Why is it good sense, or does it make any practical use for us to engage young people this way? And I think that we actually have a few different rationale for why it's important to engage young people. The first is actually very much a utilitarian approach. It's the idea that when we talk to the end users of policies, when we talk to our target groups, we are gathering insights into the demand side of our policies and programs. We're talking to them about their needs, their aspirations, their experiences. We especially get insights into bottlenecks, into obstacles. And the more that we rely on such inputs, the better we're able to design our programs, the more responsive our programs and our policies will be, and essentially the more efficient they will be. So we can already think about this implementation of the child and adolescent health strategy to think forward in terms of what is going to be the best way to actually implement this on the ground. And perhaps young people are the ones to be able to give us that insight. And this, of course, consultations with young people and advisory with young people helps to certainly complement, contextualize, and triangulate other data. This doesn't mean to say that it replaces all of the other evidence that we draw upon in our design of policies and programs, but rather helps to give it a richness, give it more insight, as well as to help us localize our programs and our policies more effectively. Another justification for why we should be engaging adolescents and young people in policymaking is because they are fundamentally key stakeholders. We heard in the opening remarks just today that the implementation is also the responsibility of youth. And when we treat young people as key stakeholders alongside the important key stakeholders of government, of civil society, of private sector, we treat them as active agents in their own development and in their own health. They are not simply passive players. They are going to be invested in those services being effective and sustainable. And what we see then is we see local ownership of some of those programs. We see more sustainability of results when young people themselves feel invested in these programs. And they're also to claim their rights to health, claim their rights to development by being engaged in these processes. Moreover, it also helps to build trust in government and build trust in our health institutions. The closer we bring young people into these processes at the stages of design, of implementation, of evaluation, the more interaction they're going to be able to have with our institutions, and the more they'll be able to trust in those services and in that delivery. We also then have a development reason for why it makes good sense to engage young people. By engaging young people, we build their capacity to question, to express views, to make decisions, and to build confidence. We support their empowerment fundamentally by treating young people as agents of change and by having them in these participation processes. And this, of course, contributes towards their self-worth, self-efficacy, accountability, as well as solidarity throughout our societies and our communities. And lastly, of course, but not least, participation is certainly a right. There is a right to participation. It's a human rights-based approach to be involving young people in the decisions that impact their lives. And this is, of course, enshrined in the Convention on the Rights of the Child and the Right to be Heard in Article 12, but also underpins all of our other rights that we have a duty to safeguard relating to freedom of expression, association, right to information. And so, of course, participation is not simply an end. It's not the goal itself, but it is a means to be able to achieve big policy and programming results. And we can think of consultation, again, in a broad range of formats. And UNICEF is really here to support our government partners in being able to bridge the divide, to connect our government partners more closely with their youth counterparts and with their youth partners. And at the regional office here, we have supported in many instances through our U report, our social media surveying platform, different consultations, surveys throughout the region to understand youth needs and youth bottlenecks, as well complemented with different types of in-person focus group methodologies. We also have several youth advisory boards and connections with our national youth councils, and we're going to be looking at two examples of these today in the area of mental health, where we have also relied on the expert insights of young people themselves, of highly engaged young people. And again, at the regional level, we are proud to have the youth partners groups at a sub-regional level, both in Central Asia and Western Balkans, that we do make available for our government partners and our health partners in the sector to be able to rely on for some engagement with young people to get some of those insights. And of course, these insights can be applied to all steps and cycles in the policy cycle. It's both, at the policy design level, but certainly at the implementation level and at the evaluation level. And again, to have that insight in the demand side of services really helps to be able to design better programs, but also young people can play a role in dissemination. They can play a role in sensitizing this child and adolescent health strategy at the local level, on social media, in their communication channels, telling their friends, bringing them to schools, making presentations. They do play a very important role in being able to be those multipliers at the local level. And again, participation makes good policy sense for more efficient and effective policies, for a better return on investments for governments, and of course for better results, development and health results for adolescents and youth well-being. I will stop there, and I'm really pleased to then delve into the different examples that we have today. First, we're going to start with the example of Kazakhstan, and just as a short correction to the agenda, today we're going to be looking at youth engagement in the development of Youth Support, which is a digital mental health platform in Kazakhstan. And I'm pleased to introduce Dr. Altane Eskialeva, the General Director of the Republican Scientific and Practical Center for Mental Health at the Ministry of Health at the Republic of Kazakhstan, as well as the Chief Psychiatric Officer at the Ministry of Health, again in Kazakhstan. And to accompany her, we have our youth representative who has been involved in youth participation processes in Kazakhstan, Ms. Anel Bektasova, a member of the Youth Support Development Team in Kazakhstan. So Dr. Eskialeva and Ms. Bektasova, I will hand over the table to you. Thank you.
Thank you for the opportunity, Christina. Let me share the screen. Hope you can see it. Second. Yeah. Окей, вы можете начать.
Добрый день, участники вебинара. Рада всех приветствовать. От имени Республиканского научно-практического центра психического здоровья Министерства здравоохранения Республики Казахстан. Действительно хотела сказать, что вопросы вовлечения в молодежи в сохранение здоровья вообще, и в частности сохранение психического здоровья являются очень важным компонентом. И на сегодня именно наш центр занимается вопросами внедрения и реализации политики в сфере охраны психического здоровья, как силами, ресурсами государственных органов, так и однозначно с вовлечением самой молодежи. Особенности, связанные с участием молодежи, это отражение потребностей и мнения молодых людей при разработке, адвокации и реализации политики и мероприятий в сфере охраны и продвижения психического здоровья. У Республиканского научно-практического центра, который курирует вопросы психического здоровья, связанных как непосредственно с состоянием психического здоровья, так и с возможностью употребления психоактивных веществ, имеется определенный опыт работы с молодежью. Они представлены на слайде, то есть ранее в проектах мы участвовали совместно с молодежью. И на сегодня идет реализация. Следующий слайд. Вот именно с ЮНИСЕФ мы сейчас участвуем в реализации платформы для поддержки психического здоровья, повышения доступности психологической помощи для молодых людей и их родителей под названием YouSupport. Участниками является как Министерство здравоохранения, вот в лице нашего республиканского центра, и молодежь активная. Начало реализации проекта было с конца 2022 года и продолжается на сегодняшний день. Проект сейчас реализуется в 3 регионах страны. Поддержка ЮНИСЕФ – это в экспертном сопровождении, в международном опыте и доказательных подходах, софинансирование и помощь в организации участия молодежи. Именно использование дружественных к молодежи методов и подходов, снижение стигмы и опыт работы ЮНИСЕФ именно с молодежью очень важен для нас. Следующий слайд. Причины для вовлечения молодежи в данную программу – это целевая группа данного проекта, она уже была ориентирована на подростка, на молодежь, то есть это клиент-ориентированный продукт непосредственно на них. И само психическое здоровье, надо признать, является самой стигматизированной сферой. И здесь необходимо видение молодежи для преодоления стигмы и поощрения поведения по поиску помощи, по поиску вопросов на те вопросы, ответов на те вопросы, которые возникают у молодежи. Форма участия молодежи заключалась в организации молодежных советов ЮСУПорт в 2022-2023 года. Это дизайн и иллюстрация платформы, которая обсуждалась непосредственно с молодежью. Это тестирование с молодыми людьми и специалистами по охране психического здоровья в течение 2023 года. Это молодежные IT-группы, учебные практики. И вот Анель дальше предоставит свою презентацию, одна из участников проектной группы ЮСУПорт. Почему же важно участие молодежи? Следующий слайд. Это непосредственно молодежь, которая вовлекалась в данный проект, она является разработчиками привлекательного интерфейса, архитектуры платформы и понятный для молодежи контент. То есть в данном случае платформа предназначена для молодежи от 10 лет. Как представитель государственного органа Министерства здравоохранения Республики Казахстан мы поддерживаем данный проект. Наши сотрудники принимают активное участие. И хотелось бы дать как бы предложение другим правительствам, государственным органам, Министерству здравоохранения других стран в том, что необходимо именно признавать молодежь полноценными участниками внедряемой программы, создавать институциональные механизмы для участия молодежи в разработке механизмов реализации проекта, быть самим участниками данных проектов, обеспечивать реальную обратную связь и влияние, понимать, каким образом те или иные проекты влияют на нашу молодежь и создавать безопасные и доступные площадки. В то же время необходимо инвестировать в образование и развитие компетенций у молодежи. Конечно, важным является это применять язык, каналы, которые понятны молодежи, и в данном случае обойтись без участия самой молодежи невозможно. У меня все, дальше продолжит Анель.
Yes, hello. I was informed that I don't share the screen correctly. Let me quickly try to change that to the correct one. Can you see it?
Yes, it's at the bottom, and if maybe you can try to click the presentation button right beside the slider there. Yes, this one. Let's see how it goes.
No, it's open the previous one.
Okay, no problem then, Anel. We can just use in this perspective. Thank you.
Anel, I'm just jumping in. This is the admin. I'm happy to share the screen for you.
Yeah, okay, we can do that, sure.
Perfect. Let me pull up.
Something.
Thank you. And while we're waiting, thank you, Dr. Eskialeva. I think Kazakhstan is a great example from where we are have been doing the pilot for youth support for some time now, and has been quite an inspiration in terms of how well the young people have been able to both play roles in various different steps of the project. And continually over time. So not simply just one moment of youth engagement, but using several different key parts to re-engage young people in a sustained way to build upon results from earlier youth participation engagement and to build upon that knowledge that young people are able to contribute. We'll now pass on to Anel. I believe the slide is starting with a green text for our technical support. Perfect. And Anel, I'll hand over to you. Thank you.
Thank you for the opportunity. First of all, let me introduce myself. My name is Victas Vanel. I am 22 years old and I am fourth year student of Information System at Kazakh British Technical University. And if we look at my roles that I played in this project, they actually changed over time. So in the beginning, in the summer of 2023, I was just testing the platform, but in the September of the same year, I was co-facilitating youth support testing exercise. After that, I was facilitating and leading the group of young people so that they could help us test the platform, and I was also advising on its development. And currently, I am a member of a Youth Support Kazakhstan project group. To be more precise, I work as the quality assurance specialist. Next slide, please. So when we talk about participation summary, how did I came to this opportunity? How was it introduced? I was actually invited by a member of a youth support team, and then I found the project not only interesting but one of great importance. If in the past I was working closely with my peers to provide the feedback, on the platform, I'm currently reporting bugs, finding them, doing some occasional IT support for the providers, and also checking and confirming any changes that were done by the Youth Support International Development Team. I was involved in different stages of the development of this project. So to name a few, it was design, it was youth feedback coordination, it was adaptation implementation, and last and not least, it was testing the usability of the platform overall. Next slide, please. I don't think it's going to be an exaggeration when I say that youth participation and their views changes the project like in a significant way. So the proposals that we had, the feedback that we had from 2023 exercise were actually implemented, and you can see them in the current version of the platform. To include the major ones as an examples, it could be introduction of a dark mode, it could be updated design, and most importantly, it's the increase in the number of resources that we have on our local Kazakh language. And by engaging the youth support became really much more user-friendly than it was before. And to give you an example, you can see the two screenshots below. One from the left side, it was 2023 version, and on the right side is more current version. Like it's more user-friendly, it's more pleasant to look at. And also, we need to say that the video consultation technology was improved to a great degree. Next slide, please. And if we're gonna answer the question why youth participation makes good policy sense, I want to talk about my example and how it changed my view on the government. So in the beginning, I think a lot of people, especially a lot of young people in Kazakhstan, think that the government don't really care about us, and if they do, it's to just check the box. It's all the lies. But this project and being allowed to participate in it show that not only they care, they are aware of the problem, and they're actively trying to solve it. And not only they're actively trying to solve it, they want you to help them. They want your input, they want your opinion, they want you to help make them the solution better. And I think that what really counts. And when we think about developing policy for any target group, but in particular for young people, it's really important to have their opinion and input, because this policy directly affects them. And when you invite them to this conversation, to this dialogue, it will, well, not usually, but I'm pretty sure it will always increase the quality of a project or a policy that they are developing. That's it from me, from my side.
Thank you so much. Thank you, Dr. Eskialeva and Anel. What an excellent example of a true partnership between government and young people. I will, for the sake of time, then move on to Cyprus. Again, another excellent example we have here in supporting mental health resilience among youth in Cyprus. And in this case, we have the exciting example of working together with an established youth network, the Cyprus Youth Council, which exists already in the country, and being able to then draw on our existing networks in youth civil society. And I'm happy to introduce Dr. Alexandros Tifas, the mental health nursing officer at the Nursing Services Administration in the Ministry of Health in Cyprus, as well as Ms. Diamando Zisimopoulou, the project manager at the Cyprus Youth Council. Please, I'm happy to give you the floor. Thank you.
Good morning, colleagues. Good morning, everyone. My name is Alexandros Tifas. I'm a mental health nursing officer from the Nursing Services Administration of the Ministry of Health, Republic of Cyprus. Firstly, I would like to thank the World Health Organization, UNICEF, and our host today for facilitating this special opportunity to meet and engage, once again encouraging the exchange of knowledge and empowering a common effort. It's truly an honor to be with you. Thank you for the opportunity to speak out on a subject that is so crucial, but also close to my heart as a mental health professional. That is how youth voice and participation is shaping mental health in the Republic of Cyprus, from actively engaging our young people in health policy to youth participation on the front line for the strengthening of psychosocial support systems and reducing mental health stigma. On behalf of the Ministry and the Nursing Service Administration, I am facilitating the coordination of the TSI project supporting mental health resilience among youth in Cyprus. It is a 2-year technical support initiative funded by the European Commission and implemented by UNICEF. It is a project for empowering the resilience of our young people and at the same time enabling a person and community-centered approach towards mental health, an approach that supports independence, honest choice, empowers its citizens, and promotes positive well-being. Next slide, please. The project has 3 main objectives. First, to contribute to strengthening of youth-friendly mental health services. Second, to facilitate youth engagement and participation. And third, to develop strategic recommendations for improving mental health support systems and policies, aligning with both national and European priorities. Just to provide you with a quick overview, in the community, targeted actions to improve the promotion of mental health are taking place, and interventions are being developed and piloted on a municipal level. Capacity building and multidisciplinary training targeted to youth workers and professionals is helping the effective implementation of youth-oriented and youth-friendly interventions. Now, on a national level, the project has contributed to the development of the National Mental Health Strategy with young people actively engaged in the working groups. Next slide, please. Furthermore, the project has also provided the first ever qualitative research analysis on the current situation of mental health service provision for youth. Strong policy recommendations and a youth engagement framework have emerged alongside a dynamic national mental health awareness campaign. Next slide, please. So we must admit, and it should be noted, that within this project, the ministry has acknowledged that optimal mental health promotion and primary prevention today calls for new tactics, and that effective strategies and programs need to embrace youth and include them both in the design, implementation, and evaluation process. They are experts of their own experience and can be invaluable in identifying and addressing problems that affect themselves. Their voices and actions can and must be the keystone of policy and interventions in areas directly affecting them. Next slide. The Cyprus Youth Board and the Cyprus Youth Council are key partners in our project. They are participating both in the steering committee and on the ground. They're developing effective and sustainable engagement with young people on the issues of mental health and identifying the best channels for providing this support. Surely it could not have been achieved without them. Next slide. Youth participation within our project has revealed new insights to enhance interventions and to fortify the health of our young people. It embraces a developmental mindset which provides the necessary flexibility to capture the true essence of our human development, often described as a spirit of change. The project is also strongly complemented with a participatory approach, enhancing cooperation, increasing contextual understanding, and supporting the developmental process for change. In addition, municipalities and community leaders are openly offering both their contextual knowledge and their premises, ensuring that this project aligns with the local needs. All stakeholders are fully engaged throughout the project, and such dialogic process represents significant democratic activity within our society. This collaborative approach is guided by the evidence-based principles provided by UNICEF's exceptional expertise, have promoted adaptability and relevance towards our desired national goals. And to conclude, I would say that this project marks a significant milestone for mental health in the Republic of Cyprus, highlighting the advantages and growth opportunities of youth participation. I am confident, based on the results of our project, that youth participation in health policy can and must be embraced by all governmental institutions. And I once again urge you to view our lived experience as a launch towards an empowering process for change. Thank you for your time, and please, before I give the floor to my colleague Diamando, if you would like to know more, we have provided the QR code link for the full report and the policy brief. Thank you.
Great. Thank you, Alexandre. Thank you, Christina, for the introduction, and thank you, everybody, for being here today and for giving us this space to present both our project, but also our collaboration work in Cyprus. So before I proceed with the project details, let me allow me to present a few things about the National Youth Council of Cyprus, since in many countries, maybe there are such structures that some may know or may not know, and I think it's important civic partners for every government or institution that wants to provide and enhance youth participation in decision-making processes. So as our name says, Cyprus Youth Council is the National Youth Council of Cyprus, which means that we are an umbrella organization for most of the youth organizations in Cyprus. Currently, we have 61 member organizations, and we represent organizations from political parties, youth NGOs, more thematic organizations, the labor union, the student councils, and many, many more. So as you can understand, we are responsible for raising the voices of young people and to advocate for youth rights and youth topics that are relevant to the current needs of youth in each given time. CYC exists for the last 30 years, and unfortunately, we are not recognized by law, but we are still recognized from some structures, including the Ministry of Health and the Youth Board as consultative bodies on youth topics. And with this, let's say, capacity, we are very thankful that both the Ministry of Health and UNICEF decided from the beginning to approach the Cyprus Youth Council, and we engaged in the TSI project on equal footing like any other partner. On equal footing in our project means that we are part of the project steering committee. We also participate in the project advisory committee with experts on with youth experts on mental health, because youth, as we already mentioned, it's not we are experts on our experience, but there are experts that they are psychologists, psychiatrists, and volunteers, and they are ready to provide their skills and knowledge on the topic. And we also support the project from day one on its implementation. So we work side by side with both the Ministry of Health and UNICEF, as well as the other implementing partners, and gave significant support through the project processes. For example, young people, including most vulnerable groups, participated in the research phase, and in order to reach them out, that would not be possible if we did not have the extensive member organization network that we have. We also, with the support of the ministry, we provided dedicated seats and secure for youth in the national working groups of the youth strategy, and we supported, of course, through the design of the national youth campaign that will follow. And please go to the next slide. And of course, as you can see here, these are some very graphic results of our findings in Cyprus. And one of them, of course, is that we need more youth-friendly services and more youth engagement in Cyprus. Can we go to the next slide? Here is again some of the materials that we'll focus in the next few years, in the next few months in our campaign. Of course, we managed to have a youth consultation on the topic with 40 plus young people that provided significant input to have this result. And let's forward to the next part. And as Christina also mentioned at the beginning, here are some of the reasons why it's very important to have youth involved in the decision-making processes is to ensure the relevance and responsiveness, because young people's direct participation ensures that programs are tailored to their actual experiences and evolving needs, and making services more efficient and improving mental health outcomes. It increases engagement and uptake because co-designed youth-friendly programs encourage greater participation and trust among young people. They reduce stigma and the barriers to accessing mental health services. Also, it supports building social inclusion and empowerment, and engaging youth strengthens their sense of belonging, agency, and connection with the community, because young people are part of their community and they are not only the future, but also the present. And last and most important for us is to improving the policy quality and innovation. Youth involvement leads to more accurate and innovative decisions, as young people bring unique perspectives and ideas that enhance service design and implementation. And that was the most important exercise we did during this project, how we can actually facilitate and find mechanisms through this project on how government and other institutions can collaborate with young people, the local communities, and also the government structures for youth in order to provide much needed services for the youth in Cyprus. Thank you.
Thank you so much. Thank you, Mr. Tifas, and also Diamando for that excellent presentation. It really undergirds how when we want to renew our health systems, when we want to make them prepared for the 21st century, involving young people, we need new tactics and new ideas, and young people can certainly be the origin of those. They can be partners in helping us to develop that. We have no questions in the chat, so I am happy really to hand off back to Gabriella for our closing remarks and last reflections.
Thank you so much, Christina. And I want to thank all the presenters, because in a very efficient way, you managed to give us a lot of content, but staying in the allotted time, all of you. So from the beginning to the end of this webinar, quite impressive. For the sake of time, we're running out of time, and I see everybody has stayed with us throughout the whole call. So let me just thank everybody. As we mentioned before, at the end of next month at the RC75, the strategy, the regional strategy for child and adolescent health will be endorsed by member states. From that moment on, we will focus all our efforts towards implementation. And we want to implement together. You can count on WHO and UNICEF country offices and regional offices capacity to support in countries. This will not only take the ministries of health effort, but all the other actors, many of them represented among our participants today, civil society organizations, professionals and organization of health professionals, young people. So we look forward to work together to improve the outcomes for children and adolescents in all the spectrum of from nutrition to health to mental health to perinatal care, especially through primary health care, ensuring youth participation. So we'll have more meetings like this with similar content. Thank you, everybody, and we'll keep you posted on the developments on the strategy and reconvene to discuss how to best adapt it and implement it in countries. Thank you so much. Have a nice day.